at Brown University for medical school, there was a lot of media attention about the Black maternal mortality crisis, which of course hits quite close to home because I'm a Black woman in the healthcare space, etc. So actually backtrack multiple years before that, I actually worked on my first documentary back in 2016 when I was 16 years old in high school. And that was to raise awareness about a birth injury called obstetric fistula. And so for those of you who are not familiar with obstetric fistula, that is a birth injury that can be caused by prolonged and obstructed labor. It happens here in the United States, but if it happens, it is surgically repaired immediately. However, in lower resource settings that don't have access to that skilled medical care, birthing people may have these fistulas for a long period of time for the rest of their life, causing them to leave urine and waste, basically, and then leading them to be socially stigmatized from their communities. So I actually went to northern Ethiopia and created a film with one of my friends from high school, raising awareness about this condition. And after that experience, it just showed me how powerful film and photography and those types of outlets are in connecting people to topics that don't necessarily affect them. And so fast forward to 2018, I knew I wanted to address the Black maternal mortality crisis in some way, and so I went back to film. And then in terms of creating Black motherhood through the lens, we oftentimes talk about maternal mortality and morbidity, which is very important, obviously. However, there are other disparities impacting Black birthing people along the continuum of reproductive health care, including infertility, postpartum mood and anxiety disorders. So you saw a little bit of that in the film. But there's also other areas, such as stillbirth, that I wasn't necessarily able to address. And so that's how Black motherhood through the lens came to be.
Awesome. That is such a powerful story to hear that you have been a filmmaker since you were a teenager. So it's destined to be. And I just wanted to share with you guys, you see the two microphones, one on the right and left, those are for you. So after we have about another 15 minutes of discussion up here, we're going to turn the microphone over to you to ask your questions. So I want you guys to have time to get your questions together. So I want to share that with you. So you shared these powerful stories in the film. How did you find the women, and how did you just choose which women to feature?
Yeah, that's a great question because, when I embarked on this film, I was like, well, who's going to allow me to follow them along with their camera in, some of the most vulnerable moments, childbirth, being in the hospital, and just talking about, traumatic experiences like you heard in the film. So I like to say I was divinely connected by each one of them. So for Dr. Jo McCullough, she was formerly a social media influencer. And so I used to take pictures for her Instagram page, and it was Mother's Day 2018, I believe, 2019, that she posted about her experience navigating infertility. So I reached out to her to see if she wanted to be part of the film, and she did. Shailene Costa, I met her through the reproductive justice space in Providence. Unfortunately, there was a case of a Black maternal death in Providence in the winter of 2019. Her name was LaShonda Hazard. And so there was a community healing event, a reproductive justice event in Providence. So that's where I had met Shailene the first time. And I'd run into her, at future events. Shannon, I found her on Facebook. She had actually given birth August 2020. And I was looking to highlight someone's experience giving birth during the pandemic. And I also had wanted to highlight the story of someone who navigated postpartum mood and anxiety disorders. But when I reached out to her, it was just on the basis of COVID, and then she actually revealed to me that she had experienced postpartum depression 7 years prior. And then lastly, Shannon Benjamin, I was initially going to go into OBGYN or obstetrics and gynecology, so I had an OBGYN mentor. I told her I was working on this film, and I was looking for a Black pregnant woman, and she was like, oh, I have a friend who's 8 months pregnant, do you want to have her in the film? And so I just remember Shannon meeting her in a small coffee shop in Providence. She was a little bit apprehensive, but she opened up. And she actually wound up giving birth 2 weeks later. She gave birth early with an emergency C-section. So that's how I was able to meet all of the women in the film.
So I wanted to ask every woman up here, what moment resonated with you the most in the film? And I'll start with you, Dana.
So, first and foremost, I should have said this in my thank you to our board member, Alisa, is here today, and she is the one that actually brought the film to our attention and said that this was something that we should do. I think for me, like she said, we always talk about maternal mortality and the bleakness of it. I just recently did an interview where I talked about Black joy, right? And experiencing Black joy and focusing on the Black joy. But for me in this film, for you to bring to light all of the issues associated with maternal health and Black maternal health, but specifically infertility. And being in my own reproductive journey and making the decision to A, freeze my eggs because I'm single, or B, do IVF, the sperm donor, or C, not have children. And for me, it was a 10-year, very long, up and down process that just recently has come to a, children thing ain't for me. But, it was an up and down process, and I think a lot of it I had to come to grips with is that I was expected to have children. And that I was being told as a Black woman, you're supposed to be a mother. People are asking, even my patients, well, how are you taking care of me and you've never had children? And so that moment for me resonated, whereas I had to make that decision, and being over 35 when I started to make that decision, and being told by my own, Black female OBGYN, because she had issues, and I felt like she was projecting those too, like, you better make a decision quick, and if you're gonna do it, you gotta do it now. Well, I can't quickly come up with $10,000 to freeze my eggs, you know what I'm saying? And so I think for me that was the moment.
That was the moment talking about the cost.
Yeah, and just the infertility and the decisions, and even, as a midwife, having people come into my office to discuss their own issues and their own fertility issues, and then being told, well, just keep trying. Instead of truly, the book's telling us 12 months. Well, if I'm, trying after 3 months and I'm irritated, I'm frustrated, and all the mental health issues that now come in, is my husband or my boyfriend or my partner going to leave me, and all those other things. I'm disappointed. I'm not bringing home the grandbaby, because that's the biggest thing in the Black community for supplying that grandbaby.
I'm waiting on some grandbabies right now.
I know, you better take the side lesson.
No, I haven't said a word. I'm just like secretly hoping, wishing in my heart for some grandbabies.
Yeah, so I think that was the moment for me, the infertility.
Well, I'll say, I have 2 wonderful children who are adults now, and I made the conscious decision to have a Black OBGYN deliver my 2 kids, and I think that's why I have positive experience and results, because I was an older mom. So I'm gonna turn to our other panelists. What was the moment that resonated most with you?
So for me, there were several things in each story, but the most important thing was the experience that the mom had that didn't have access to care. So I was a young mom. My boyfriend at the time was now my husband. We've been together for 24 years, but at that time we were not married. And so we found out that we were expecting right out of college. And we did not have insurance, and so we went to a lot of free clinics around. We went to Womankind. I don't even know if that still exists, but I'm so grateful for them, because they were the saving grace on helping us to understand what our options were, right? Because they always talk about that to Black women, if you really want to have this baby. But having access to care was a big challenge for us. But then also to hearing from the last mom about that support system of having someone who looks like you, who was in the room with you, and that was not my experience. And I wish that it was. And I think, and I hate to do the shameless plug, but one of the good reasons about the Project Noir survey is that they're trying to understand what those things are that creates community and the things that we need as Black women, and hearing it directly from Black women so that we can support each other. So
Well, you brought it up. You might as well go ahead and do the full plug. Do the full plug.
Because that's my role up here today.
In case some people haven't done the survey, so go ahead and do the plug.
So if you haven't taken the survey, projectnoircle.com, it is an opportunity for you to be able to share your experience as a Black woman, what you experience in healthcare, what you experience in the workplace, what you experience through education so that we can understand how we can better support each other and the issues that we face that we're not able to talk about with our healthcare provider, that we're not able to talk about in the workplace, that we're not able to talk about with our educator who may be talking down to us or things in that way. So being able to hear some of those things in this film resonated with me and just wanted me to be able to like, I gotta say it, I gotta talk about it. But yeah.
Well, thanks for that plug.
I think real quick too, Twilight, it's not a shameless plug at all.